Does my child have asthma? Is a question parents often ask, especially parents of infants and young children, especially toddlers, and especially those children who have recurrent episodes of cough and wheezing. And it is true that to a certain extent of infants and toddlers who do have recurrent cough and wheezing do go on to develop asthma later on in their life, and it is it's mostly seen in those who have a strong family history, especially parental history of asthma or allergies, and also if the child themselves have proven food allergies or allergy to various environmental allergens, or they have a skin allergy also called atopic dermatitis or eczema. So what can parents of young children, especially toddlers, do to tackle this? Number one, it's important to be sensitized to these symptoms, which include recurrent coughing, especially at night, in the mornings, associated with fast breathing, and quite often the child's pediatrician will tell parents that the child is wheezing. This could mean that your child has asthma symptoms. So it's very important to seek specialist help, especially of a pulmonologist or an allergist, to go through and review these symptoms and provide a good treatment plan. Number two, if your child has recurrent symptoms of cough and cold and wheezing and is nebulized quite often, every few months or more than that, or every other month, then that means that your child requires some preventative treatment. Usually the medication which is prescribed are inhalers, which are provided through a spacer device, and it is very important to be on it because nebulizations may just suppress the symptoms for a while, but it does not really tackle the underlying problem, which is of allergy and asthma. Number three, once the treatment is prescribed, it's very important to be adhering to it and not stop it prematurely just because you feel your child is better, because it takes some time for the underlying process to come under control. And it is also very important to be aware of what rescue treatment can be given at home for your child, and also what the importance of using preventative treatment is. And all these medications are quite safe and they don't really cause much side effects. In fact, very minimal side effects. So it's very important to know that. Number four, it is also important to try and minimize triggers which could be leading on to these symptoms in your child. So trying to minimize dust collectors in the house, which could be soft toys, woolen fluffy blankets. All of these should be washed regularly. You should be vacuuming the sofas, curtains, carpets, etc. regularly as well. Trying to get rid of mold in the house, staying away from animal dander,